I'm Nurse Jessica Seitz.
And I'm Nurse Erica.
And we're Nurses Uncorked,
the podcast that takes nursing facts
with nursing comedy and makes a cocktail out of them.
Don't forget to hit that subscribe button wherever you listen to podcasts. And please rate, review, and download.
Also, if you're interested in supporting Nurses Uncorked podcast and getting early access to episodes, behind-the-scenes content, and bloopers,
check out the Patron link in the description of the podcast. Hi guys, welcome back to another episode of Nurses Uncorked. It's me, Nurse Erica, and my lovely co-host, Nurse Jessica. And today we have an RN with us. Her name is Kelli Johnson, and she's going to be talking about an extremely innovative and exciting new bill. And we'll get to that. But first, we have a cocktail of the week, I believe.
We do. And I just want to say it is possible to talk about a bill and have it exciting. Because to me, that sounds like an oxymoron. You're like,
no, this one truly is.
Bill.
Like when you guys hear this, you're going to be amazed. You're going to be amazed.
Don't turn the podcast off just because you heard that. I'm telling you.
No, like I wish I could take credit for her idea. It's that good.
Yeah, it's important. Like seriously. But what's more important right now is this drink I have to share. So Erica gave me this idea to do this because I am 50% Cuban. If you do not know, si yo puedo hablar español. Yeah, let's do it. So. Okay, I'm doing a Cuban coffee drink. I gave Erica a recipe book for Christmas time as a gift, and there was 2 Cuban recipes in it. So I already mixed it together, and I already sampled it, and it is strong as fuck, people, okay? Woo, the Cubans don't mess around. That's all I gotta say. So this is very easy to make. It is 1 part dark Cuban rum, and I'm sad to say as a Cuban, I did not know that there was Cuban rum, but there is. And this was recommended to me. It's diplomatico. Doesn't that sound serious? It's like like some dictator's going to cut your head off if you don't drink it or something. I don't know.
I mean, it's Cuba.
Yeah, I used 1 shot of the Cuban rum. Then you add in 3 parts coffee, a spoonful of sugar. I use Splenda, a dash of cream liqueur. I used Bailey's because that's what I had. So I don't know, but this is the Cuban coffee.
Is that the actual name of it?
Yes. Yes, it is.
It's that strong. It's burning you.
It's strong. And that's that I felt like I didn't even use enough rum. Like I went down a notch. So, hey, if you want to get hammered in the morning, this would be a great recipe for you to try. Or the afternoon. You can have Cubans drink coffee all day, anytime, any place. So, the Cuban coffee, it's good if you like coffee, and it's good if you want to warm your throat up. It's just a lot of rum at okay. Maybe take the recipe down a half notch on the rum.
For the rum.
Yeah, that would be my recommendation. Or drink it later at night when you don't give a fuck.
Yeah.
Okay. All right.
Well, I know you've got another Cuban drink coming at some point in the future. We'll try another one.
Yeah, let's schedule that podcast for the evening. Okay?
Okay.
All right.
Sounds good.
Sounds good.
All right. Let me tell you about our guest today. Kelli Johnson is a BSN prepared registered nurse with well over a decade of nursing experience. She's worked in level 1 trauma centers and currently works as an emergency department nurse in Seattle, Washington. Kelli spent the last 2 years on the bargaining team for her union, UFCW 3000, and she was part of a large strike for safe staffing language in 2023 that Jessica and I attended. And in addition, Kelli participated in the 2022 and 2023 legislative sessions supporting the passage of the safe staffing law, which enhanced the role and responsibility of hospital staffing committees. But she's here today to talk about a really exciting and innovative new bill that truly, hear me when I say, could revolutionize the way that we hold healthcare administrators accountable. And as I said, I'm really kind of annoyed that I didn't come up with this idea myself. Welcome, Kelli.
Thank you for that wonderful introduction. I'm very excited to be here And I am just really glad to be hearing this kind of response, that people also think that this is just such a great idea, and could have such a positive impact on how we are caring for our patients in hospital settings. So
Yeah, wait till you guys hear about this. But before we get into the bill, can you just tell us a little bit of some of your personal experiences as a nurse that led you to get involved and change the system? Like, have you witnessed patient harm as a result of insufficient staffing, that sort of thing?
yes. So just to preface first, the beginning of my nursing career was actually in Missouri, which is a right to work state. Unions are frowned upon. So when I moved out to Washington, which is a heavily pro-union state, it was a learning experience for me. And I think that's really important to note, because if you're going to be someone who wants to take on these type of issues in the work setting, it is really beneficial to have a union, be a union member and be protected when you're speaking out. And honestly, that is also the reason why I started speaking out. This started for me back in like 2021, 2022, when I just had a manager say to me, I see a few nurses sitting at the desk, not doing anything. I need you
Mm-mm.
guys to get up and move these patients out of the room. And that statement alone just really pissed me off, because I think all nurses can relate. Like, just because we're
Yep,
sitting down doesn't mean we're not doing anything. But that was a morning where she caught me at the nurse's station and I wasn't even sitting down. But I hadn't even touched my morning coffee yet. And it was like already 10:30 in the morning. And I'm
of
like,
course.
so
Oh,
you're
that's
saying we're
that
not
right
working hard
there.
enough, but I haven't even touched
That's
my
a
coffee
problem.
yet. And working at a hospital that was unionized, that started me looking into, okay, what does the union say about this? And then reading the contract, and then seeing that there was a state law that said nurses could have some say in the staffing in their departments, and then doing a deep dive into that. Well, what's happening with the staffing committee? What are we saying about this? What are we doing about it? And then it's just kind of spiraled from there, if you will, learning that uh, during COVID, emergency orders were in place. So a lot of regulatory bodies were not enforcing a lot of laws because of the emergency orders. That means hospitals weren't being held accountable for what was happening. Then being on the bargaining team. And I just want to add, so when there were a large group of nurses that were going to legislators saying, hey, we want this committee bill passed, but we want it with ratios. Going to the committee hearings where everyone can provide testimony, and hearing the Washington State Hospital Association answer a legislator saying that nurses could negotiate for staffing ratios, we just choose not to. Therefore, it's
Mm.
like our fault that we're in the situation that we're in. And it's like, okay, bet I'm going to be on the bargaining team, and that's what we're going to do. We're going to bargain for staffing language. And no one knows how difficult it is to be on a bargaining team until you are on a bargaining team. And anyone who has ever been on a bargaining team can immediately relate to that statement. That is an extremely difficult thing to do, to be on a bargaining team and try to get employers to agree to language that just makes sense. And I imagine that all the nurses and doctors who are on strike in Oregon are empathizing with that hardcore.
Yeah.
But we didn't win the staffing language that we wanted in the bargaining team. And so it's just become really apparent to me through my efforts to improve staffing at the hospital I work at that laws matter, and the language in those laws matter, and what law can get passed that can address this issue that is becoming extremely pervasive in hospital settings.
Have you ever had to report incidents of patient harm to the Department of Health or other agencies? And what were the outcomes?
I have had to report numerous times, sometimes on behalf of my coworkers because they were not comfortable filing that report themselves. And I like, once you put yourself in the hot seat, like, then it's like, okay, well, why not? Like, they already don't like me. So what's one more reason to give them to not like me? But just to go on a side adventure here a little bit. To anyone who's listening to this and they are worried about filing these reports, the more people who are reporting it, the better. Because at some point,
Mm-hmm.
I'm just a mouthy person and they don't care about what I have to say because I'm always complaining. And so if you're relying on a select few people to always be the ones to speak up and report things,
That was me.
like eventually it's just not as impactful as we would want it to be. So the more people who are reporting and advocating, the better. As far as like filing complaints with the Department of Health, yes. I and a few other nurses have filed complaints to the Department of Health where patients were harmed. And it's through the Department of Health investigations and the corrective actions that they told the hospital had to implement that made me realize like there is a gap here because so for example, uh, a patient's blood pressure tanked and we weren't staffed well enough for the nurse to become aware that that happened to the patient. They ended up being a rapid response. And I don't know for sure if that led to death or not, but it was harm that was preventable and got reported to the state. So the Department of Health came in and said, well, you need to have people sitting at your monitors so that they can alert the nurse when this is happening.
Right.
And they came in on a weekend and we were already going to be like 10 nurses short on night shift, which was like critical. And the hospital leadership was refusing to page out for travel nurses or like Aya does the Aya per diem. So they wouldn't bring any additional staff in. They were refusing. They were saying, no, we're not going to do that. And the Department of Health said, well, you have to pull 2 people from your staff to sit at these monitors or else we're going to close your emergency department. So in that situation, it's just like our issue was we didn't have enough staff to respond and know that this was happening in the first place. And your decision is now further exacerbating that problem. And the problem is the hospital is not staffing the emergency department and you're not addressing that problem. And it's like, why aren't they addressing that problem? Well, because it's not regulated. Like there aren't any state laws that say that there's a minimum number of staff that you need to have in any given department. So they only regulate what is written into law. And so they look at what we're doing as nurses, doctors are doing, and what the hospital at large is doing. But it's just witnessing the Department of Health coming in to do an investigation, what they implement that doesn't address the problem at all, and then realizing like, we need to fix that. So what could fix that? Like if I'm held to a standard with my license and doctors are, and the hospital is, but it's the people who are running the hospital that are making all of these decisions and they're not being held accountable. Well, why not? And it's, for me, it just was like an aha moment. It's like, because they don't have a license. Like every other part of healthcare is regulated by licensure, except for this huge workforce inside of hospital settings.
Yeah.
So maybe they just need a license. And I think it was just like as simple as that.
All right. What about staffing committees? What has your experience been? What's your opinion of them?
Oh, God.
I have strong opinions of staffing
If
committees.
hospitals were truly altruistic organizations and they lived by the motto that nurses and doctors and every other licensed clinical healthcare worker does, which is to do no harm, then staffing committees are great. And there are definitely hospitals that welcome the collaboration. They listen to the recommendations, they implement the recommendations. The problem is that there are enough hospitals that do not care at all what the hospital committee says. They do not care at all what the recommendations are. They do not care at all if the environment that they're creating is harming patients. They just don't care. And I can't say definitively this is like me speculating, but I imagine that there's a room they sit in and they decide, okay, can we afford to break this law or can we not afford to break
Yeah,
this law?
for
And
real.
if the penalties are not significant enough, then they'll just pay the fine.
Mm-hmm.
And the only time
Yep.
they really get concerned is when they're faced with potential immediate jeopardy of having their license suspended or revoked. But there's just so many examples of where a hospital should have their license suspended, but it's not, because at the end of the day, that harms the entire community. And no regulatory body wants to be responsible for making a decision that limits access to care. I think hospital committees can be really pointless depending on what the language is in the state law.
So that kind of segues into my next question. So basically, you think that they could possibly just sit around and decide, we're going to follow this law because it could cost us a lot of money if we don't, versus, fuck it. This one's dumb, and the fine is so minimal that if we just cut 18 employees out, then who cares?
We're still
that kind
winning.
of thing. Like, yeah. Do you honestly think that that's kind of how they do it, how they play it?
Yeah, absolutely. And I think
maybe not that dramatic, but you know what I'm saying.
I think
yeah, generally speaking, yes, I do think so. And I was on our hospital staffing committee for 2 to 3 years. I was actually the bedside co-chair for the hospital-wide committee this past year. And we had spent months and months and months working on our staffing plans that were required to be submitted January 2025, this month. And part of the law says that, we have to vote on it as a committee. It has to pass by a simple majority. And then that's what gets submitted to the Department of Health. And to add on top of that, the Department of Health made it required that both I and the leadership chair has to sign off that we had the vote, this was the vote count, and this is what we're submitting from those votes. So we did all that. And in the emergency department, which we always seem to, face the brunt of bad decisions that the hospital makes, and therefore the patients face it too, we decided that due to our volume going up and our overall acuity going up, that we really needed nurses to have a 3-patient assignment, because we have a mixed acuity model. You could have 3 ICU patients or like 3 med surg patients. So just to make sure that all patients are getting the care that they should be receiving, 3-patient assignments was what we settled on. And we were very reasonable about it. So why did the chief nursing officer call me on New Year's Eve day to tell me the hospital decided that they did not have to submit that staffing plan? Told me didn't need my signature, even though the Department of Health said that my signature was required in order to submit the staffing plans. Said they didn't have to submit the votes or anything. So what they're doing now is they're essentially challenging the Department of Health, and what is the Department of Health going to do about it? And in the meantime, in the ER, we are still struggling to take care of patients appropriately. And so, yes, I can say through lived experience that hospitals absolutely do choose whether or not they're going to follow a law. And it doesn't matter what happens to the patient. And to me, that's because they're not held accountable for the harm that is incurred.
That's like the same thing with what's going on in Oregon. Even though they passed the safe staffing, they have not implemented the fines yet. So
the hospital's like, fuck it, we don't have to do anything yet. What are you going to do?
Like what are you going to do? What's the ramifications? Or at least, hey, we're going to milk it until June. Like, hurrah, hurrah, right?
Yeah. That is literally what they're doing. And that is what is happening with the staffing committee law here too, because those staffing plans can't be enforced until June, July of this year. So the really bad apples are saying, well, we don't have to worry about this until July. And then there's the hospitals who are like, nope, we don't want to upset anyone. We're going to implement this. We're going to work on it. Like, don't look at us.
So basically your experience and nurse trauma, because we all have that, led you to create a concept that now just recently became an official bill. It's HB 1567. Yes, round of applause for that. That was huge. Yeah. Can you explain the concept to everyone? And I will tell you guys that she had to explain it to me a couple of times for me to really get it. But like, you need to hear this because it's brilliant.
So this concept honestly just started off with me like almost 2 years ago, being like, why are they not held accountable? And it's like, they don't have a license. And then I just spent some time researching on how nurse licensure even came to be, and, physicians being required to have a license. And I was just like, okay, so states created this. So why can't we create new licenses all the time? Like, why not them?
Them being, just clarify, them being
The hospital administrators. And when I say hospital administrators, I mean the unit manager, the clinical director, the CNO, the CEO of the hospital, all like from lower level management up to executive leadership.
Yeah.
And it was just like, okay, one, I just pulled language from our Nurse Practice Act here in Washington and pulled some language from the Physician Practice Act, and I tweaked it to resemble what it is that hospital administrators do. And how I got the definitions of what hospital administrators do is I just asked Google what their job description was. Like, what is it that they're responsible for doing? And your lower level managers are responsible for supervising licensed clinical professionals and making sure that we are practicing to the standard that we're expected to and that we're not harming patients. And so absolutely a manager should be held accountable if they have a nurse or a doctor that they are knowingly is putting patients at risk for harm and not doing anything about it. But also, you have your higher up leadership that is responsible for setting your budgets for your departments. They're responsible for writing your policies and procedures that tell us what we're supposed to be doing when we're caring for patients.
The number of FTEs you can have per unit.
Yes, the fiscal, and the broad term is just fiscal operational decisions that determine patient care inside of the hospital setting. And that is how this concept came to be, was what is it that they do? How does it impact patient care? And how can we take language that already exists, but make it specific to hospital administrators?
For those that might not have caught that, it's a licensure requirement for hospital administration so that they have a governing board agency that they can be reported to, that they are held accountable to, that we have recourse, right? So
yes,
they are responsible for knowingly, purposely understaffing this med-surg unit. There's an adverse event. The nurse is reported, but administration that put them in that position is never reported, and there's no account. This circumvents that. It creates accountability. And it's fucking brilliant, Kelli. It's brilliant.
Thank you. Thank you. I'm really hoping the legislators agree, because they are the ones who are tasked with passing it. But yes, and everyone, the other thing I thought about whenever coming up with this concept was a lot of people have been really focused on what private equity is doing in healthcare, specifically in hospitals. And so I spent time watching, there was a really good congressional hearing for Steward Health, which is a private equity company that has caused multiple hospitals to close and go into bankruptcy. But the CEO, who was actually asked to provide testimony to Congress, never showed up. And it's just like, that is an example of someone who should be held accountable.
Yep.
And they, like, the state legislators had testified saying that they had reached out to Steward Health and tried to work with them. And it's just like, well, the reason why nothing worked is because there was no personal accountability for that CEO. And like, we just hold everyone else in the healthcare industry responsible through our license. And the beautiful thing about a license is if you have been found to harm a patient, you are removed from the healthcare field. You can no longer practice and be in a situation where patients are at risk of you harming them. Why are we not taking that same concept and applying it to hospital administrators who have a farther reaching capacity to cause harm, because their decision cascades across the hospital setting? That their capacity to cause harm is so much greater than my individual capacity as a nurse. And it just makes sense. And why hold the whole hospital accountable too? Like, it's a business, so why penalize the entire system for one individual's choices or multiple people's choices. That doesn't make sense either.
So how has it been doing this? Is anybody helping you? Are you the lone soldier? Are there other nurses joining you putting this together, or how's it going? How's that happening?
I have to thank, so I like this first started off of me just talking about it and seeing if anybody else agreed with me. So there was a nurse that I worked very closely with for the Safe Staffing Committee bill that was passed. And I talked to her about this a few times, and she worked with me on kind of like refining the concept. That way, when I went to like pitch it to UFCW, like it made more sense. Cause let me tell you, it was rough. Like the first time I brought this up, like my idea was very rough, and hard to follow. But she helped me refine that. And then there were two physicians who also helped me with those conversations. And we all worked together with my union, UFCW 3000. There's a gentleman there who his job is primarily government relations and policy. So we all had been meeting since April to like put this concept together so that it could be presented to legislators. And I just reached out to legislators in my area, both in Snohomish County and the Everett area, people that I had met over the years uh, through being on the bargaining team. And because out here you build relationships with your elected officials and newspapers and stuff like that. So through all of that work, I became somewhat familiar with these people. So they agreed to meet with me over the summer, fall, and they are like, okay, this is an interesting idea. And one of my legislators was like, yeah, send me like your concept, and I will give it to a policy writer. And the policy writer is the one who makes it look like a bill. So if you read the bill language, I did not write. They're very good at that job, but they took the concept and then adopted it into what bill language looks like. And right now, I'm still working very closely with UCW 3000 on this, and there are a handful of nurses who are working on it as well. Some of them are SEIU members, which is a huge healthcare union out here, and then obviously some of them are WSNA members. And so we are just, quietly, we haven't gotten too rowdy about it yet, but we've been like, yes, but we have been working behind the scenes to meet with legislators and talk about this and get other people involved. Definitely a team effort.
What has it been like working on the bill during the legislative session? What's the experience been like?
It's intense. And this is considered the long session. So it ends April, the very end of April is when session is over. But there's a lot of steps the bill has to even go through before it reaches the governor's desk. And the first step is that you have to have a legislator who's going to sponsor the bill in the first place. So there was like 2 to 3 weeks of like just panicking, like, okay, who's going to be the sponsor? Who's going to be the sponsor? And then now that we have a sponsor, and it's called a blue sheet, and it's literally a blue piece of paper that other legislators sign saying that they're willing to co-sponsor the bill. So you have to have that in order to submit it. So that got submitted, and now we're in a place where we have to wait for the House Healthcare Committee to give the bill a hearing. And that's what we're waiting on. The House chair has agreed that he would give it a hearing, so we're just patiently waiting. And in the meantime, we've been reaching out to different members on the House Healthcare Committee to get them familiar to this idea. And I just want to say, like, nurses and doctors are tougher critics talking about this concept than the legislators. They're just like, yeah, this sounds great. Who's in opposition? Who's working on this with you? So the conversations with legislators are actually easier than you would think.
Who are we anticipating will be required to have the license? This is the part that I really actually wanted to hear when I read through these questions. Like, who are we listing down? Because I want to know who's accountable for this. What would be ideal in your mind?
And so the bill does have the concept had two definitions. The policy writer broke it down into anybody who performs these tasks in the hospital setting. So if you're supervising clinically licensed healthcare professionals responsible for hiring them, firing them, or responsible for your unit's budget, then you would be required to have this license. But it even goes as high up as if you're someone who's responsible for writing policies and procedures that apply to licensed clinical professionals, or you supervise the managers who are responsible for supervising me, the licensed professional, they would also be required to have this license. So it's broad and yet specific at the same time. So do I imagine people from HR to be required to have this license? Well, if they're not directly supervising licensed clinical professionals or writing policies and procedures, no, I don't imagine that they would need to have this license. Do I think the CEO is going to have this license? Absolutely. Do I think the CMO is going to have this license? Yeah, because they're responsible for setting policies and procedures that doctors are supposed to follow. So yes, all the way down to the unit manager, all the way up to the CEO, CMO, and even the CFO, because they're also responsible for the budget and financial decisions of the organization.
I love that so much.
What if the person is already like a nurse, or they are a physician or something that is in this role, so they already have the background? Would that like eliminate them, or would they still go through this also licensure of getting? I mean, you may have said that, but I just wanted to clarify to be sure.
No, I'm glad you're clarifying. Yes, they would be expected to have this license on top of their medical license or nursing license. And the reason why that is that like, I encourage anybody and everyone to go read your Nurse Practice Act for your state.
Yes.
Because that language alone is actually pretty broad too. It just defines general responsibilities that nurses have. You're responsible for assessing the patient, you're responsible for giving medications to a patient, and you're responsible for delegating tasks appropriately. The CNO is not assessing patient, like they're not doing direct patient care. So you can't hold them accountable for their leadership decisions because it doesn't involve direct patient care. There's like this one small caveat where you can report a chief nursing officer, in my opinion, and this is really just my opinion, but where you can report them is if they are knowingly allowing a clinically licensed professional to continue working if they're harming a patient, because they're supposed to report those types of behavior. And so if you're not fulfilling your role as a mandated reporter, then you can also be held accountable through your license. But as far as their leadership decisions, no, our nursing license doesn't cover that.
That differs a little bit state to state. So there are some states, not nearly enough, that do have a separate additional type of Nurse Practice Act for leadership where you can report them. And most people don't know about it. There is in Nevada.
And maybe that'll be something that you guys can touch on in another episode too, because I don't think I didn't know that.
Yeah.
That some states had additional
and no
language.
one does, and they never utilize it. And we need to be reporting. And just in general, what it is it's not that you're getting reported for the direct patient care. You're getting reported because you have failed as a leader to provide them with the resources and working conditions necessary to safely care for the community at large.
Every state should consider adding that language as well for a chief nursing officer. But this bill, if passed, would cover so many.
So we're going to take our halfway break and do our problem of the week, brought to you by stinkbombodorBlocker.com. Problem of the week. Erica, have you ever walked in a patient's room, and I know you're going to say yes, but you go in and there's a smell, like just something really bad, and it's nothing that the patient can help, but it's just something that is not something you want to smell all day long. Has that ever happened to you?
Oh, yeah. And then you try to use the hospital provided air fresheners, which don't even smell good, and it embarrasses the patient sometimes, makes people cough. But luckily these days we have odor blocking technology in Stink Bomb odor blocker, and no one knows that you're using it. It fits in your pocket. It's clear. You dab it under your nose and the patient can't tell. You can even rub it on the inside of a mask if you want to. It maintains patients' dignity. It's so easy to use. Tell them where they can get it.
If you go to stinkbombodor.com, and they've got tons of products, but use code uncorked15 and you're going to get 15% off your total purchase. This is a must-have. So this problem of the week that we're going to talk about is a problem that we heard over and over again when we were at the Providence strike in Portland, Oregon. And Erica and I, let's take it back a little bit. We were a little bit surprised that the people of Portland, the nurses and everybody, is not that there's a bad thing about being nice, but they are really, really, really nice. Like, to the point that, like, we're just not on a strike line. You know, people are frustrated and they're trying to get their point across, and you know, it's rowdy and noisy, and you know, so one of our first questions that we get enjoyment out of is, what are y'all doing with the scab buses? You know, like, what we want to hear all the juice. And repetitively at every place we went to, they would say, oh no, we're not doing that, we're not getting
we
there.
respect everyone's decision.
That the hospitals were sending out a lot of emails and things about no bullying, no blah blah blah, and they didn't really know what would constitute bullying, and nobody wanted to get in trouble because, you know, in their mind, we're going to have to come back to work, and then am I going to be seen bad because I was one of those people? And they were all like, what constitutes bullying? And I'm like, I don't know, any strike that I've been to with Erica, like, they always, that's go
loud,
to the scab
rambunctious,
buses.
Disruptive. Yeah.
Not that, like, I understand violence is bad. I'm not saying, like, you know, throw a rock through their window or something, but, you know, you prove a point of saying, like, you're upset that the replacement nurses are doing this and that you're even having to be out here. And don't come at me and say somebody's gonna take care of them. That's a whole nother podcast, okay? But what constitutes bullying? I think that's a great question that a lot of these nurses don't know the answer to.
I think, first of all, it's that's union busting right there. That's just a plain old fashioned scare tactic to try to intimidate the employees, and potentially use something against them when they do return to work by saying, you know, you violated this, even though I'm sure there's no policy for it. But I do know that from at least a couple of the different strike locations that we went to, they had the nurses that are about to go out on strike give report directly to the scabs, which is bullshit.
I've never heard that either.
They're literally setting them up for failure. I mean, there's a reason. And it's not that they can't do that. They're not breaking any rule. It's that you shouldn't do that. And they did that on purpose because that only creates more strife and, you know, all of that.
When they finally reach a resolution with their contract negotiations, they should definitely consider not receiving report from those strike nurses.
1,000%. Yes.
For our strike, our managers took report.
Exactly.
And then relayed it to the strike nurses. And they should.
And you're not supposed to even be, sorry to cut you off, but like they're supposed to not even use the same entrance and exit. Like you're not supposed to be in vicinity of each other because of the heightened emotions and all of that. And so Providence, in at least a couple of the places, and I'd be willing to bet all of them, we're just like, yeah, fuck it. Not only that, we're gonna make you be together, and then we're going to threaten you and say you can't do anything that they can arbitrarily claim is a form of bullying. Like that's bullshit.
So basically, their union busting is working. They're
I don't know if it's
their tactics are working because none of the nurses they're fearful to go.
Or are they just so nice? Because they did say it's the Pacific Northwest way. Like, we're just really nice. I don't know. But yeah, I've never seen anything like it. At one of them, they said there's this scab nurse that comes out every day crosses the street to go get lunch from like a pizza place, walks right by, and I mean, like, you could reach out and touch her right by the strike line every day, and no one says a word.
Well, they're obviously,
What?
these replacement nurses
What?
are not intimidated at all by them, because they're like, they ain't even bought. That's probably the easiest freaking scab job they've ever had. Like,
It's crazy to me, but
I will come to Portland anytime.
Don't lose sight of the fact that historically strikes were violent. You know, like,
right.
We're talking tire irons, slashing your tires kind of stuff. And do not misinterpret this. We are not saying that should happen again or anything remotely like that. But what they're saying is bullying is literally just people acting like they're on strike while they're on strike. Like, it's literally just them holding up signs and yelling and being disruptive, because that's the point.
Move,
or saying,
scab,
boo.
get out the way.
Yeah,
get out the way, scab. That's what we did in Hawaii. That was fun.
It's not bullying. Like, be so for real. That is straight up union busting and intimidation tactics, and don't fall for it. But I don't know, Kelli,
so if any of the Portland nurses are listening this upcoming week and you're still on strike, which hopefully you won't be, but if you are, come on, people, get there. You're not bullying. You're doing what you're supposed to do when you're on strike. Don't let them nurses feel like they can walk over and get a pizza.
Strike nurses should be made to feel uncomfortable, especially at the rate that they're getting paid. If you're going to make bank, then I'm going to embarrass you for taking this job.
Exactly.
And they should be like,
make
shift
bank
change.
At our expense.
Yeah. And when there's shift change happening, get your people, go to where the bus is arriving, stand there, let them know that you're there, that you're protesting. They have all these amazing signs. Get over there, like, show them what your signs say, like, show them what you're fighting for. I would not be as nice. I would definitely be where the strike nurses are entering and leaving for the day, and we would be there, and we would be on the megaphone. At our strike, I mean, we had the sign. Like,
if you guys
want to talk about like harassing and bullying, like, was
the Batman sign that Jessica and I lost our shit over, where they had a secret location, and they would like, what do they call it? Project it onto the hospital from far away, and it would say like, strike in 2 days, nurses going on strike, or strike day number 2. Like, it was the best thing I've ever seen.
And nobody has ever replicated this genius since.
Providence, and we are a Providence hospital as well. And let me tell you, they were extremely frustrated and upset by the sign and couldn't do anything about it. And so it's like, there are definitely things that you can do that humiliate the strike workers and the employer without it being considered bullying. And there's not anything they can do about it.
Yep, exactly.
Erica, can you imagine if you and I were in charge of organizing this, what would go on at the strike? Like, the activities?
Oh, yeah.
Oh, my God. Because we could take the best pieces from all of these ones that we've been on. Yeah. We'd have, like, flashing signs on the building.
Oh, my God. It'd be amazing. But we did hear that at one of the strike locations, there is one solitary nurse, didn't get to meet her, but one. God bless this nurse, that takes it upon herself and goes to wherever the scabs get off the bus every day and holds up a sign by herself.
Just one lone
Reach out soldier. To us. We want to talk to you. Like, yes, ma'am.
She needs some friends. She needs some friends joining her.
You guys need to go and join her.
And I apologize to the nurse that wanted us to come the next morning and at 6 a.m. We wanted to, but with travel and having to get the rental, we couldn't make it happen. And I'm sorry, but I would have liked more time there so that we could
loved to have gone to that.
Fix the scab bus thing. But anywho.
But long answer short, that's not bullying. That's union busting and intimidation tactics. Don't fall for it.
All right, let's hop back into our questions. Erica, take it away.
All right. So what are the educational requirements for this administrative licensure? Will they be required to like take an exam? What type of information, knowledge will the exam test on?
Can they take a personality quiz too? Can we throw
Because they're
that
all
in there?
narcissists.
Might have to slip a note to the Secretary of State for that one. But speaking of the Secretary of State, that is who would be responsible for determining what the exam is.
Okay.
And like the process of taking the exam. But we did make sure that there was language that just outlined that they need to be able to demonstrate that they have the knowledge of state and federal regulations that us licensed clinical professionals have to adhere to and the hospital has to adhere to. And they need to be able to demonstrate that they understand the ethics of providing patient care. Because that's a huge piece of it. There's a lot of decisions that are made that are not ethical whatsoever.
Yep.
And so the exam would test for that. And, this bill could have been 20, 30 pages long if we really wanted to get into like the details of it all. But we thought it would be better to just leave it up to like the Secretary of State and other regulators who do this. That's their job anyway. Why? No need for us to figure it all out in order for the bill to be put forward. So nothing is written specifically in the bill, but in my mind, the Secretary of State would say if you're a hospital administrator and you're employed at a hospital here in Washington, you have 90 days, 60 days, whatever, to take this exam. And then the state would provide a course, whether it be a week long, 2 weeks long, however long they feel like it would be necessary in order to ensure that these hospital administrators have the information they need in order to take the exam. But they would be required to take the course and then pass the exam. If they don't pass the exam, they don't get the license, they can't be employed within the hospital setting. But that, to me, that's how the educational and licensure exam requirements would work, kind of like how TNCC works. So for nurses who work at a level 1 or 2 trauma center, you're required to have trauma nurse certification within a certain period of time of being employed at that organization. But you're given a course on it before you take the exam. So to me, this would be very similar to that. So no need to go back and get a new graduate degree or anything like that. If you already been in the industry, then you should have some general understanding. But this is to ensure that you know state law, you know federal law, and you understand the ethics of healthcare.
That's so reasonable. I mean, that should already be an expectation. But let's be real. They can go and hire the guy that works at 7-Eleven to be the CEO if they want to. There's no requirement. I mean, getting your car registered when you move to a new state is much more highly regulated. And these people are responsible for patient lives.
Do you want to know? I have a suggestion. I think what we should also add in there is that if they're coming from a non-clinical background, that they're required to spend, 2 weeks with a nurse shadowing them for 2 weeks to understand what it's like as far as safety-wise when you're understaffed and what these nurses are going through on a daily basis. I don't think that's asking too much because a lot of times they have no clue, no iota, no idea what patient safety is. And I don't care what type of exam or certification or test they make them go through. Nothing is going to make them understand that unless they've either been in the industry or they fucking have to shadow somebody. There, I said it. I feel better now.
But they would have to regularly shadow someone because there's something to be said about that separation between the screen and reality.
True.
They might experience it for a couple weeks, but it would probably just take a month or two before them being behind the screen and they forget all of it. Yeah.
No, that's very true. What do you anticipate the timeline to be for this? How long? When will administrators be required to have this license? Like, how long till this bill could possibly go into effect?
if it passes,
Mhm.
the language
No,
in
no, no.
the
When
bill,
it passes, knock on
when
wood.
it passes, I have to
Yeah.
be realistic. There's a lot of people who told me like bills don't pass the first session. So just be mentally prepared for that. So I am working as if it's going to pass this session, but I also don't want my heart to break if it doesn't.
Right.
But if and when it passes this session, end of April, the bill says that they would be required to have this license by 2027. So it'd be a
Okay.
pretty quick turnaround.
Okay.
And so there is no grandfathered language in the bill. If you're already working as a hospital administrator, you would just automatically get the license. No, the expectation is that you would also have to, as of right
Good.
now, the expectation is you would also have to take the exam and apply for the license.
What situations could result in a hospital administrator being reported to the state?
Some real life experiences that I think of. So I'm not sure how many people are familiar with this story, but there was a neurosurgeon in Eastern Washington who was also employed by Providence that was doing unnecessary spinal surgeries, but then also billing for things that he wasn't doing. And he was reported by the OR staff to the hospital administrators numerous times. And it took the federal government intervening before they put him on administrative leave, and then he just resigned after that. So yeah, the federal government had to get involved. But what's really interesting is that Multicare out here then turned around and hired him even though the federal government had reached out to them and said, hey, we're currently investigating this neurosurgeon for these
Wow.
practices. You may want to reconsider hiring this person. They decided to do it anyway. And
Wow.
the reasoning for both Providence and Multicare allowing this person to remain employed with them was because he was extremely profitable for the organization.
Sure.
And they even they had payments structured as to reward him for the more surgeries that he was doing. So he got paid more by the hospital for more surgeries that he did.
Yep.
Now, there were hospital administrators who were aware that patients were being harmed, but looked at the papers and was like, but we're making so much money. Like, we'll just ignore it. And so the neurosurgeon lost his license. Providence as a whole, all of its hospitals is under a probationary period for 5 years for fraud. But those hospital administrators, as far as I know, have not been held accountable unless for some reason Providence is high up executive leadership decided to terminate the administrators who were directly involved and allowing him to continue to work. But they can just go to another hospital and work as well. And that doesn't make sense. So that's one example. Okay, you're responsible for making sure that us licensed clinical healthcare workers are not harming patients. And so part of that responsibility is making sure that we're not working for your organization when we are being reported to harm patients. So that's an instance of where they could be reported and investigated. What I mentioned earlier in the meeting, the chief nursing officer calling me and saying that they do not have to have my signature,
Mm-hmm.
that's a violation of state law. In that situation, you could be reported for not following state regulation and being investigated for it.
Yeah.
And I think it can be even situations where okay, say it's a hospital that's doing what they're supposed to be doing. They're, allowing their staffing committee to put forth staffing plans and their intent is to implement it. But the manager fails to post positions in order to have the department staffed according to the staffing plans. And then a patient is harmed. That manager can be investigated for his or her decisions to not staff the department appropriately. And if found to have been responsible for the harm, they can have their license suspended or revoked, and they wouldn't be able to work in any hospital here in Washington. And I feel like there's so many examples of where this could apply, but those are just some real life experiences that come to
Mm-hmm.
mind for me where something like this would hold hospital administrators accountable.
And let's say something really tragic happened, like they're investigated because they may have led to a patient being harmed or a sentinel event or dying. What would happen to them? What are the ramifications of them doing something?
For now, it is just having the license suspended or revoked, and it would
Okay.
prevent them from working in any other hospital here in Washington.
Good.
And I'll just leave it at that. I know that there's things are changing for nurses and physicians, and we're seeing a lot of them being criminally prosecuted, but we are not proposing this bill with the intent that it will lead to criminal
Okay.
prosecutions.
Okay.
Our intent is that we just want to make sure that the right people are in these jobs and that their
Right.
priority is to do no harm, just like that's my priority. And that's the standard that we're trying to set here. And if you can't meet that standard, then you shouldn't be working in a hospital setting.
Yeah. Who do you think might be in opposition of this bill?
I do think the
I
Hospital
can think of one.
Association.
That's the one.
But the more I think about the Hospital Association being opposed to this, the more it doesn't make sense to me, because the only other pathway then for accountability is holding the hospital at large accountable. And it's an entity that is very pro-hospital, very pro-hospital business. So even for them, I think it would make sense that you would want to get rid of the hospital administrator that is such a huge liability to the business. But I imagine their knee-jerk reaction is to oppose this because they represent people very high up in the organization, people who make millions of dollars a year working for the organization.
Right.
I do imagine there are going to be CEOs who are opposed to this. Again, they're making a lot of money in these positions and they're not going to want to be held accountable for it. So those are people I think of that will come out and say, we oppose this bill.
Basically, anyone that also opposes all and any proposed nurse to patient ratio legislation. All of those people.
Anything that could place limitations on their ability to prioritize profits is going to oppose this.
Correct.
And this would have a limiting effect on profits being the priority, because the patient should be the priority. And sometimes that is not always profitable.
What are you talking about? It's crazy.
I know. Sometimes I think we're the ones who are wrong, and that's the problem. I'm just kidding. I don't think that at all.
I know, but I know what you're saying, that they act like we're insane sometimes, right?
Gaslighting.
Yeah. Mm-hmm. What's the current status of the bill? Where are we at with it, and what needs to happen next? So, I mean, I know you've got the bill number, but where's it at, and what's the plan from here?
It has been referred to the House Healthcare Committee, obviously. So we are waiting on the chair to give it a hearing. And that is when we are going to find out who opposes this bill and why. So that should be a juicy one to follow once it's scheduled.
Ooh,
and I will be posting when it's scheduled. Hearings are open to the public, and anyone can provide testimony if they want to. Or they can even just sign. Well, anybody who lives in Washington. Let me specify that. Sorry. Anyone who lives in Washington can provide testimony, and anyone who lives in Washington can sign in pro or con to the bill. And that always, if it's only the hospital association and the people who oppose it who are speaking out, that is what the legislators are going to hear. And I imagine it won't go very far. But if they're hearing from nurses, especially doctors are not as involved in the legislative process as they probably should be. And I know that there's a lot of concern that they'll get terminated from their job, and because of the non-compete clauses and stuff, they're worried that they're not going to be able to find a job or whatever. But there are ways to be involved in the legislative process without being public about it. You can always reach out to your legislator via email. You can give them a call. And no one's going to be able to take a screenshot video of what you said about it and retaliate against you for it.
And get all of your friends and family that also live in Washington State to do the same.
Everyone should want hospital administrators to be accountable for decisions that they make, because everyone at some point in time is going to have to go to the hospital. or
Mm-hmm.
know someone who is going to the hospital. And it is just becoming an industry where it is hospital administrators who are holding the bag. Like they're the ones
Right.
who have all the responsibility, and we're just the ones who have to deal with whatever it is that they decide to do. So
Yeah.
patients, everyone should be like calling their legislator, like, yes, this is what we want. We've been screaming into the void that there's not enough accountability in healthcare. This is something that would get us closer to that.
Okay.
Have you experienced any retaliation at work since you started this process and your advocacy?
Yeah, I have. And so one very obvious is this summer when the hospital leadership was not following the state law. I kept saying, you're not following the law. I would send emails with clips from the law and the DOH website and then
Just
point
like
out
me.
how they were not following the law. And I actually got pulled into an HR meeting to investigate if I was bullying or not. And if I
Here we
was,
go. Here we go again.
and if I was violating their code of conduct. But what's funny about their code of conduct is part of it is also following state and federal laws. And I was, so just like in the meeting, I was like, okay, I'm just following the code of conduct of making sure that we're following state and federal law. And I'm pointing out when we're not. And I'm like, I think it's concerning that they're like, I'm pointing these things out and the behavior isn't changing. And so did I get any formal write up or anything from that? No, but it definitely made me reconsider what I was putting in emails. And that was the intent
Right.
of the meeting is like, we
Right.
don't want you sending these emails. And we're telling you that. So if you don't make some sort of changes, like in my mind, it's like, if you don't make some sort of changes in how you're communicating, then we are going to hold you for bullying. But that is a form of retaliation. And then there's always
Yep.
just the microaggressions that happen
Yeah.
too. Not that I would ever want to be charge nurse, but Lord knows they're never going to let me, like, even if I was crazy and I wanted to be the charge nurse, that's a position I would never be
Right.
given. So as far as like me advancing my career at that organization, it is limited.
Yeah.
And that's a example of a microaggression that happens.
But you're also represented by a union and you have wine garden rights, and that comes with levels of protection because what you're doing is protected activity.
Yes. If I was still in Missouri trying to do this, one, it would take me so much longer with the legislative process.
Yeah.
Being a union member, and honestly, just really, not every union is perfect. I definitely have my criticisms of UFCW 3000, and I have ideas of how they could be better at representing their union members. But what I can say is, if you want to get involved, they're going to let you get involved. They will support you. They won't restrict you. And this bill is just like one of those things. Like, it's like, I have an idea. Will you listen to me and will you help me? And it's like, yes. If I was in Missouri in a largely non-union state, this would probably take years to happen on my own. And that would require building relationships and getting buy-in. And luckily in a state like this, like they've built those relationships. They've built that buy-in. So it just makes it more feasible to happen in the first place. And then also with it, if the first time I spoke up because I was told we were basically being lazy sitting at the desk and that happened in Missouri, I would be terminated. I have no doubt in my mind I would be terminated. So
Yeah.
very grateful to be a union member.
Yeah.
Thank goodness.
I know how differently things could be if I was not part of a union.
So before we talk about how you can get involved more or where you can follow on the bill, we're going to switch gears for a minute. And I think we all need to laugh for a moment at Erica's expense.
Oh, no.
So we're going to do the Enema of the Week award. Erica has one to give away, and it's brought to you by our sponsor, Happy Bum Co., the leader in at-home enema solutions. Yes, Kelli, we have an enema sponsor for our Enema of the Week. It's brilliant.
Enema of the week. Jessica, with 2 little kids, do you ever find time for yourself to just like lay down, sit down, and relax during the day?
No, hell no. Never. And I should.
Well, one of the benefits of using Happy Bum Co., a leader in at-home enema solutions, is it kind of forces you to lay down and relax for 15, 30 minutes, and it can help relieve your stress in addition to the, physical aspect, but you get to lay down and relax.
I'm
It's
not going to
it's
lie. When I do use my happy bum, I put on some music and I kind of zone out. So it does give yourself a little bit of relaxation time, and that is much needed. As healthcare workers, we need to take care of ourselves.
and
So
you get to do it in the comfort of your own home.
yep, absolutely. Check out happybumco.com and don't forget to use code Nurses Uncorked and get 15% off your first bundle. Yes. So Erica, who are you giving this bad enema to? Not the good enema like Happy Bumco, but who do you, I already know. So
This week is just purely selfish and petty on my part. They can't all be, I'm
already
big overarching things. But someone allegedly by the name of Nola Johnson
allegedly. All right, fine. We'll leave that there.
on Facebook, Nola felt the need to message me and say, "You need a new hairdo. The bangs? Question mark, question mark, question mark." Listen. And then I told her what she can do with herself, and she said, "You're the one on social media tattling on everyone. Good platform." I don't know what that's supposed to mean. I am so tired of people criticizing my hair. Like, I cannot win, and I realize this is not important in the grand scheme of things at all, but indulge me one week to be petty. If I don't have bangs, you all roast me and tell me I have a 5 head and you could land a plane on my forehead. Like, you're so awful to me. Feel free to laugh. Jessica's hysterical right now.
Well, what I want to say is, what kind of person takes it upon themselves,
right? Who does that?
To send a message to somebody
it's awful.
To say you have a horrible hairdo unless you are in management. Because I'm saying, tell me you're a manager or a hospital admin without telling me you're a hospital admin. Because in one turn, they're making fun of you, but then their next thing is to say that you're a tattletale. What are they scared of? What are they scared of from you, Erica?
I don't know, but let me just tell you the challenges with my stupid bangs. Like, I've dealt with this my entire life. Okay, I have 2 of the worst cowlicks known to mankind in my bangs, and it's one on each side, and they each go all the way out to the side, like away from my face. They're the worst. But listen. So I know I'm not justifying her shitty comment. I'm just saying the amount of work that I have to put into trying to make my bangs look even remotely normal is beyond anything that any human being should have to do. Like styling products, heat tools, like all the things. And that's why it always looks like I don't have bangs right here, because they're going the other direction. No matter what I fucking do, it's terrible. So I can't win. Like, if I have the hair off my face, y'all are roasting me for my forehead. If I have my bangs down, you're roasting me for my bangs. I'm doing the best I can, people.
God dang it. She's doing the best she can.
So Nola
and now
Johnson,
she's having to read emails about her bangs too. On top of it, y'all are taking important time away from Erica. Nola, get a life. Nola, get a life.
Yeah, and Nola Johnson, allegedly, this Enema of the Week award goes to you.
Okay. Anywho, on that note, how can we support the bill, Kelli, and how can we follow along? How can we find out what's going on? Where can people get involved? All that.
I will say Nurse Erica is going to be a great way to follow along, because I will be sending her links and messages as things progress with the bill. If you live in Washington, you can sign up to subscribe to the bill, and you'll get email notifications of when it's moving through.
I'll put that link in the description of the podcast.
Okay, good. All right.
So those are 2 great ways to follow along, or just if you want to, participate. I would love to see people in other states reach out to the legislators and say, hey, do you see what Washington is doing? We should do the same.
Yes.
Because that's what is really going to make this bill the most powerful, is seeing more states pass something like this, and this becomes a nationwide standard. So
Awesome.
and feel free, anybody else who's interested in this, like, go to Washington State Gov, look at House Bill 1567, and you can forward that to whoever you want. You can rip off of that bill.
Use it as a template.
All you want. No, yep.
Because how amazing would it be if every state had held their healthcare administrators accountable and we had a way to report them? Like, just think about that. Think of the implications. That would be a game changer. So I applaud you, Kelli. This, like I said, is brilliant. I wish I'd come up with it myself. And I know that you're just a fighter. And I know we're going to see you in a political position, political office at some point. I just know you will, because you're that determined and that smart. So keep an eye on.
And also petty. I also want people to know that, like, petty energy can really get you far sometimes.
Yes.
Like, if someone makes you, like, your employer upsets you enough, like, find out why, and then find out what you can do about it. Because there are pathways to hold employers to a higher standard.
And lesson learned, don't tell Kelli she's doing nothing at the nurses station
in
the future.
I know.
Okay?
I know. Message to managers everywhere. Watch what you say to your employees, because it may be
they may have
one
a bill
you regret
coming up
the most.
Yeah, you might do that, and next year they're have a
you
bill
have to
passed.
get a license because of her.
Yeah. I mean, and honestly, thank you, Providence. Like, if they didn't care about patients whatsoever, like that's why I'm here. Like, their energy is why I'm here.
Yeah.
So thank you. Thank you for helping me see the problem and seeing where the gaps are,
the problem.
and motivating me to get involved. I thought it was really interesting on their Instagram page. They did an ode to Martin Luther King, who is like, what people don't always connect about him is, like, yes, civil rights, but he was also labor rights.
Mm-hmm.
And so it was just really interesting for them to give a shout out to him. And it was like, he was also labor rights. Mm-hmm. And you are the one organization that motivates people here in the Western part of the country to push back on what you guys do as employers.
Thank you, Kelli. And keep us informed.
Yeah. Thanks, Kelli.
Thank you so much, guys.
Until next time on the next Nurses Uncorked.